everybody, my name is Lilian Momina and welcome to my YouTube channel. I'm a clinical nutritionist and today I want us to discuss about a very sensitive topic, erectile dysfunction. In Kenya or in Africa at large, sexual conditions, sexual problems are not as talked about or as dominated as they should be. We're going to discuss the causes of erectile dysfunction, the changing trends, some of the things that you can do to improve the situation, and definitely the nutrition management and or some of the foods that you can take in order to improve or promote your sexual health and sexual function. What is erectile dysfunction? Erectile dysfunction is basically the inability, it has to be consistent and persistent. It is not a one-off thing. Most men, from research and from asking here and there, most men usually experience sexual hiccups every once in a while, but that should not be termed as erectile dysfunction. It has to be persistent and it has to be consistent. So it's basically the consistent and persistent inability to maintain an erection through a satisfactory sexual engagement. In the recent past, ED was basically a condition that was associated with older men. It still is, but unfortunately the young population are also coming up with it. There's a lot of empowerment whereby the girl child currently is very empowered. This means that women nowadays have some sexual expectations from men, which was not a thing in the past, especially in Africa. In the recent past, the society used to define or used to determine how the woman's sexual life will be. The husband used to have the only say, but currently with empowerment and all that, there's a lot of expectations, especially for the male child, to perform. These are some of the causes that are bringing about erectile dysfunction in young men. Again, there's also these parties and the sexual orgies and all that, whereby people are discussing sex and sexual performance freely. This again brings that pressure, the psychological pressure. Some of the downsides of having erectile dysfunction, it lowers your fertility. If you cannot erect, you cannot ejaculate, and you cannot definitely reproduce. It becomes a problem. Then another thing, there's also the psychosocial effect of not being able to perform. So you get that they become anxious, stressed, there's anxiety, there's depression, and sometimes if it's severe, you get that some men here and there, they're committing suicide because of some small issue, and this should not be the case at all. So we want to make sure that we empower our males to make sure that they are working towards an improved psychosocial health and improved sexual health too. Is erectile dysfunction also common in teenagers? Yes. Teenagers and young adults, that is from maybe 17 years to roughly 29 years. So you also get that there is a lot of societal pressures that is not excluding this age group. There's also maybe a lot of alcohol, smoking and cigarettes, the parties, the orgies, and all. Pressure is more in that category than in the other categories. So what are some of the causes of erectile dysfunction? We have too much smoking, too much drinking, and too much drugs. Then non-medicational drugs like cocaine, heroin here and there. So how does this cause erectile dysfunction? It alters with your metabolic health, it alters how your blood pressure is, it alters how your mental health is and all that. With continuous drinking, continuous smoking, continuous abuse of drugs, you will get ED. There's a direct link. So the second cause of erectile dysfunction is age. As you grow older, you get that you are predisposed to getting erectile dysfunctions after a certain age. Males after 50, most of them report having problems with erections and getting to that maximum level of sexual pleasure, that is ejaculation. And this figure is bound to increase because, again, you see in the African setup or in the Kenyan setup, males don't seek medical help, they don't seek psychological help, and rarely will you find them seeking even nutritional help because most are expected to be strong, or I don't know, their peers expect them to be strong, so you'll find that males suffer more. So this figure can really be higher. After 50 years, you get more than 50% of men will report erectile dysfunction here and there. Of course, it is lower in the younger population, but it is still there. Then we have poor dietary habits that promote metabolic syndrome, like too much consumption of processed and refined carbohydrates, too much intake of sodas, juices here and there, refined foods, lower intake of whole grains, lower intake of fruits, lower intake of vegetables, lower intake of good fats and all that. All this predispose you to having erectile dysfunction because it will affect your metabolic health. Your metabolic health affects your mental health. Your mental health affects your sexual performance. And again, with bad diets, you're also predisposed to cardiovascular disease. Erectile dysfunction is a precursor of cardiovascular diseases. So people who have erectile dysfunctions have a higher chance of developing cardiovascular diseases such as stroke, congestive heart failure, hypertension, diabetes and such. So if you have erectile dysfunctions, you need to make sure that you alter your diet to make sure that you prevent the metabolic complication that will predispose you to these diseases in the future. So you need to make sure that you tone it down on the sugars, you tone it down on the saturated fats, you tone down on the processed carbohydrates, refined foods and all that. You put the third cause of erectile dysfunction, you have obesity and physical inactivity. So you don't work out, you overconsume the bad fats, you overconsumed on the processed carbohydrates, you overconsume on the sugar, so that you get like your visceral fat is high. So this alters your organs, how they are functioning. There is arterial fat accumulation and all that. This alters your blood pressure. You see, with erectile dysfunction, anything that alters or distracts how your blood is flowing will predispose you to that. You need to ensure that there is an adequate circulation of blood to make sure that there is flow in the penile area so that you can get and maintain an erection for good times. So you need to make sure that as much as we are also working on other things, you do some physical activities here and there, you work on your weight to reduce the incidences and occurrence of erectile dysfunction. Another cause of erectile dysfunction is have psychological stress and like anxiety, tension and all that. You're constantly supplied with stress. You have so much, maybe stressful working condition, stressful family relationships, stressful financial situation. You're just constantly stressed. What I have gathered is that sexual performance in males is connected to their emotional well-being and their mental health. So if you're in a stressful condition, you might not be able to maintain an erection, and again there's a lot of production of the stress hormone, the cortisol. So you need to make sure that you work towards controlling the stressors in your life. If you like, you can do maybe yoga, you can do physical exercise, you can share. Men don't share so much, but you are encouraged to share so that you make sure that your mental health is well taken care of. You reduce anxiety, you reduce depression, and you reduce all these stressors. The other cause is having chronic metabolic disorders such as diabetes, hypertension and all that. When you're having these metabolic disorders, there's reduced functionality and performance of the endothelial cells. So you get that the blood flow is also compromised. And again, vitamin D utilization goes down, and you need all this for the proper function of the endothelial cells, that you can have your blood vessels pumping the blood and improving and promoting the blood flow well to improve sexual performance. Another cause of erectile dysfunction, we have masturbation and pornography addiction. You'll find that most men who are addicted to porn and masturbation tend to have difficulties with having an erection and maintaining an erection with the females or their sexual partners. But again, addictions are very, very serious, so you need to control this. You need to control the masturbation, you need to control how much pornography you're watching. Lack of a good sleeping pattern, of course, there's sleep apnea and all that. Then the medication side effects, you might be on drugs, maybe hypertension medication. Now that we've talked about the causes of erectile dysfunction, now we can talk about how to manage or control this condition or to prevent it. These are the things that you can do or you start doing right now to make sure that you prevent the occurrence of ED and also manage if you have erectile dysfunction. Of course, most of the nutritional management will center about nitric oxide and controlling blood pressure and improving blood flow. What are some of the things that you can do to manage and control erectile dysfunction? One of them is increasing foods that are rich in nitric. Nitric oxide is a compound that most cells in the body can make and utilize. It promotes oxygen intake, it promotes blood flow, it promotes vasodilation. This reduces blood pressure, and so when the blood pressure is reduced, there is adequate movement of the blood in the arteries and the vessels and all that. The vasodilation comes in, there is adequate supply of blood in the penis or the pineal area, and this promotes erection. First, with nitric oxide, you want to increase your intake of oxygen, and this you need to promote breathing using your nose, nasal breathing, so that you increase intake of oxygen into your body. The oxygen uptake will also promote a conversion of nitrates to nitric oxide. So when you take them from the food, you make sure that you also improve your breathing techniques. You can work out, you can do physical exercise. Exercises are great. I did a video on how to exercise to promote maximum benefits. I'll link it down below so that you can have a look and see how you can improve your oxygen uptake and all that. But when you take in the foods that are rich in nitrates, they are able to be converted into nitric oxide. It promotes blood pressure control and it promotes vasodilation and all that. So some of the foods that are rich in nitrates and are good for controlling erectile dysfunction and preventing it, we have the beetroot. Fortunately, we have it in Kenya in plenty. It is rich in nitrates, it is rich in folate, and all this improve blood flow, blood circulation, blood volume, and all that. We also have the green leafy vegetables. We have the spinach, we have the skuma, we have the terere, the managu, we have the saga, all these, the dark ones. They are very rich in folate, they are very rich in nitrate, and the bioavailability of these nutrients is higher compared to other foods. So you need to make sure that you take up this. And also you need to make sure that you're taking in adequate protein, because the amino acid L-arginine promotes the conversion of nitrates to nitric oxide. So take your proteins right, and make sure that you do meal combinations so that you take in the essential amino acids, all of them, from your proteins and from your whole grains. Then also reduce the intake of processed carbohydrates, refined carbohydrates, and intake of table sugar. Control your blood sugar. You want to make sure that your blood sugar is also controlled. Again, take whole foods because they are richer in other nutrients. We have magnesium, we have calcium, we have potassium, all these beneficial essential nutrients that you need to take up for, so that you make sure that your metabolic health is well taken care of. And then control pressure. I did a video on controlling hypertension. I will link that down below so that you have a look on some of the things that you can do to manage hypertension. So make sure that you check it out. It will be very beneficial. Also, another thing on management, make sure that you control your content, the content that you're watching. Reduce pornography, reduce masturbation, reduce all these media, control them as much as you can. Then do physical exercise. Another thing that you want to do, you can also increase your vitamin D intake. This is as easy as getting sun exposure 1 hour a day. Studies have found that diabetic patients who have erectile dysfunction, their vitamin D levels are usually low. Again, vitamin D is also associated with improved endothelial tissue and reduced risk of cardiovascular diseases. When the blood is flowing well as it should be, there is more transportation of oxygen to the active sites, there's more transportation of nutrients. So another thing that you can do is manage stress. You can talk to a psychologist. I know it is hard as a man in Kenya or in Africa because most people will term you as weak if they are seeking psychological help, but please do. If you feel like you're depressed, you're overwhelmed, you're anxious, your stress levels are getting above a certain level, or they're really affecting the way you're sleeping, they're affecting your sexual health, they're affecting how your moods are, they're affecting your dietary patterns and all, you can reach out to a professional help or even share with a friend. Air out your issues. Don't allow stress to put you down. Take care of your mental health, take care of your stress, and do physical exercise. Work out, run, do yoga, do breathing techniques to increase your oxygen supply and all that. Before you start on the blue pill, kindly work on your dietary practices and improve zinc. Foods that are rich in zinc, we have the nuts, the beef, the meats and all that. They're rich in zinc, dietary zinc. So take it. It is great for sexual health, it is great for semen production, sperm quality, sperm motility, and improves your sperm count. Also the omega-3 and maybe fish, take eggs here and there. Make sure that your meals are as dense as they can be. And control your alcohol, control smoking. You can also take on vitamin C rich foods, which improve your immunity, they improve your functions, they reduce oxidative stress, and then they also maximize utilization of the nitric oxide in the cells. So take up your fruits, take up your lemons, take up your grapes, take up your oranges, strawberries, all these. Make sure that you're doing vitamin C. That's it for today. Thank you for listening and stay around because you will learn more. Bye.